you see, I think it's interesting because although I was a pharmacist, we were all trained in health promotion. So my skills naturally morphed to providing a holistic, personalised approach. And also, very early on in my career, I was steeped in some of the social determinants of health. So I became interested in poverty. I became interested in ethnic minority issues within communities, poor access to healthcare, poor access for children to access, services and physical activity options. So all of this came together, and I'd got quite a good strategic footing on that. In terms of individual patient care, I realised very early on that there was a gap in the market in terms of how we promote exercise, how we enable communities to have opportunities for people just to do some physical activity. I mean, the WHO launched last week, so this podcast is really timely because they launched the brand new WHO physical activity guidance and recommendations and in sedentary behaviour for the first time in 10 years. So I first came on the back of the original guidance, and now it's been updated. But I think the problem has been is that we try to be too pedantic, and although I do love my definitions as a pharmacist, I felt that the definition stuff by Casperson is a real hindrance. And I know I speak about this a lot. I think we got ourselves into a pickle over what was exercise, what was physical activity, and what was movement. And I think it's interesting because since our editorial in the British Journal of Sports Medicine, where we actually called it out and said, look, this needs to be a movement for movement. We need to be talking about movement. I mean, the guidance has even stopped using the 10-minute bouts now. So it is the strapline for the World Health Organization is every move counts, and for the UK Chief Medical Officer's physical activity guidance, it is some is good, more is better. So it's encouraging patients, communities, and the population to do things that are meaningful within their own context. But I mentioned things about poverty and the social determinants of health. And I think as healthcare professionals and organisations, we forget that they are some of the biggest factors. So, when you start to listen to patients, it's not because they don't want to exercise, or even special populations, with cancer patients or people with disability. It's the research has been done, and it's not that they don't want to exercise. It's somebody facilitating that conversation, which absolutely, my passion is 100% in healthcare professionals supporting that role. And I think it's not just for physiotherapists and occupational therapists. I think everybody from consultant teams to doctors, nurses, and allied health professionals have an important role, not only in hospitals, but in primary care, but in their day-to-day activities, because actually poverty and the social determinants of health are one of the biggest reasons why people don't have, they make up those excuses. But actually, when you listen very carefully to patients, and I'll give you an example, for cardiac rehabilitation services, really important, really evidence-based rehabilitation post-cardiac cardiac event. And I think the access for men is at 79%, the access for women is 21%, or something along those lines. So that's a shocking inequity. So I come at this from inequities in my conversations. So the excuses, or excuses I used to call them, I don't think they're valid, in as much as when you explore these conversations and connections which is going on. So for example, in cardiac rehab, some of my Asian ladies who were hoping to access cardiac rehab, the timing was wrong. It was mixed sex classes. They had to get 2 buses across town. And actually, I don't think that's their excuse. I think that's the health organisations and societal excuses, because we put so many barriers in front of them. So, I mean, the biggest thing that I say around excuses is, I mean, even I have to put my trainers on, lace them up, and get out the house before my brain engages on what I'm doing or what I'm trying to do. And it's literally, you know, sometimes I have to leave my yoga mat in the lounge, so I can't avoid it. You know, it's there, and I have to. And I see it, I thought, oh yes, I really do need to do some stretching, you know, a downward facing dog or whatever. I mean, at the moment, I have to say I do child's pose on a regular basis, simply because I need to defrag my brain. But I think that when we start to understand patients, most patients want to be well. Most patients want to feel better within themselves, both physically and mentally. And I think, as all health care professionals, but particularly in physiotherapy and occupational therapy, the advocacy role and the opportunity to influence, you know, like that cardiac rehabilitation, for somebody to stand back and say, well, it's no wonder that we haven't got funding, or we haven't got a business case for this, or we haven't got the right patient numbers to support the service. Because often that is because of the complexities and the ambiguities in healthcare. So Exercise Works attempts to embrace all of that understanding, but with the premise that healthcare professionals have a unique role to change that paradigm.